The Connect2Health FCC Task Force at the Federal Communications Commission is excited to preview the next iteration of the groundbreaking Mapping Broadband Health in America platform. As you'll see, this platform is not just a series of maps. It reflects a new way of thinking about, a new way of visualizing and analyzing the intersection of broadband connectivity and health. In the next 5 minutes, we'll highlight just a few examples of the platform's capabilities and innovative functionality. In addition, we'll tackle 3 sample questions about broadband and maternal health that the new platform, when launched, will help you ask and answer. With that, let's get started. One of the biggest challenges the new platform tackles is how to intersect county-level broadband with maternal mortality data, given the data suppression inherent on the health side. To put our progress in perspective, a picture is worth 1,000 words. This was the platform then. You can see most of the data on maternal mortality rates is suppressed or grayed out. And this is the platform now. We're leveraging proxy variables like preterm birth and low birth weight to light up the map and allow stakeholders to extract actionable insights around broadband and maternal deaths, something we couldn't do before. Here, we've intersected internet adoption and preterm birth, and what you're seeing is one picture of the digital divide in maternal health. In the purple, double burden counties, 4 in 10 households do not have a high-speed internet connection, and there are higher risks for preterm birth. Increasing internet adoption at adequate speeds in these priority areas may help improve maternal health and reduce risks of maternal death. And to take this a bit further, let's filter by race and ethnicity, and let's further filter by maternal age. Imagine, what if broadband could transform access to maternity care? Let's acknowledge a sobering reality. In an ideal world, if a pregnant woman could not access a doctor, hospital, or midwife near her home, she would have robust digital or virtual resources to help bridge the access to care gap. For many mothers in the United States, that is not their reality. In fact, over the past 5 years, more than 100 rural hospitals have stopped delivering babies, and by current estimates, 700 rural healthcare facilities are at risk of closing. We know that broadband can make a difference, and the platform puts the power of the data in the palm of your hand. This first map we've generated shows the rural broadband and access to care gap for maternal health. It tells you exactly where we need to intervene. The counties in purple are double burden, all 560 of them. They have below average fixed broadband access and are designated as maternity care deserts, which means that in these counties there is no hospital, no birthing center, no midwife, or other obstetric care provider available. But the new platform can show us even more. By applying one of the platform's powerful new filters, we can now see that in more than half of those double burden counties, again colored here in purple, the majority of households do not own a car, exacerbating the lack of connectivity and access to care problem. And we visualized those priority counties with just a couple of clicks. Here's another twist. What if a policymaker or public health department or broadband provider wanted to know where to intervene, or was hoping to isolate where new infrastructure should be prioritized, or wanted to identify where women are at the highest risk across both broadband and health? All the user would need to do is to further tailor the map by focusing on the subset of counties where, for example, women lack access to adequate food. According to the CDC, food insecurity places women at a higher risk for maternal death. In seconds, you would see the places in rural areas where increasing broadband resources could extend a critical lifeline. But there's so much more that the platform can show you. And access to care is only part of the story. What if you could paint a picture of broadband connectivity in areas where pregnant women face life-threatening risks of gestational hypertension and diabetes? The platform takes this challenge and raises the bar, providing multiple ways to slice and dice the data. This next picture is from the platform's Broadband view. With a few clicks, we see a color-coded map of access to both a fixed broadband and mobile connection, but only in areas with above-average rates of pre-pregnancy or gestational hypertension or high blood pressure. You can see the counties with lower connectivity metrics in beige and gray, particularly in the South, Southeast, and Ohio River Valley. The platform also allows you to pivot and explore geographic differences. Notice how, when we intersect with pre-pregnancy or gestational diabetes, the areas of need shift north to Appalachia and the Midwest. To put it another way, these maps visualize the work that remains before we can extend an always-on connection to every pregnant woman facing the highest risks. That way, their doctors can monitor them remotely and intervene in case of emergency. Now let's be clear. This is far from an academic exercise. Each of these visualizations represents real families potentially facing tragic loss. As you can see, the new platform is highly customizable and user-driven. In this short preview, we've barely scratched the surface of the new platform's capabilities. There are many stories lurking in the data waiting to be told, so the way that you use the platform may not be the way that others do. And that is the true power of mapping broadband health in America.